Okay, so today we're going to be trying the McConnell's Tape Job. The McConnell's Tape Job is using Hypafix, this is what the box basically looks like, with also Leukotape P. Okay, so Hypafix, once you take it out of the box, it looks like this. This is the adhesive side, so you will be ripping off the piece of paper to stick it onto the skin. When you're trying to do the tape job, make sure the area is nice and clean, so you want to make sure there's no oil residue or any dirt or anything there. You're going to want to measure out the tape first to see how long you need to cut it. It's going to have to go relatively far on the knee joint, so it's past the actual kneecap. Okay? What you want to do is take the one end first and basically lift off that piece of paper and remove it all the way across. Be very careful, don't do it too fast because the ends will curl in on each other, and when they get stuck together, it's very hard to pull them apart. Okay, so once we have your three pieces on here, what you want to do most of the time with patellofemoral syndrome, what's happening is the muscles on the outside of the knee are overpowering those on the inside. So what we're trying to do is basically prevent the kneecap from moving outwards, so we need to be pulling the kneecap back toward midline. So how that will happen is you take your piece of the Leukotape P here, you're going to want to pull it basically right on the edge of where that kneecap is, and then you're going to want to measure it, cut it to where probably just below that, just before you get to the white end. Okay, so it's going to be a relatively small strip, but we'll be using multiple. So from here, pull it over as far as you can, just like that. Okay. There are different techniques to the McConnell's tape job depending on what you're trying to achieve. So in this video, we're only trying to achieve reducing the lateral movement of the kneecap. We could also be trying to help if you notice that there's a tilt in the kneecap, you feel like one side sticks out higher. How you would do that one would be putting a piece right in the middle of the kneecap and then pulling down. If you're feeling like it's rotating on you, you can kind of pull from down here and kind of maneuver the tape so that it comes around and holds it in that spot. But for now, we'll just stick with the one version. So again, on this side of the kneecap, kind of measuring it, cutting it before you get to that end piece. Leukotape P can be very difficult to rip, so at times just grab scissors, it's a lot easier. Just like that. Kind of making sure the majority of the kneecap is covered. I can probably do one last piece right at the bottom here. Perfect, and that's how it would basically look. It's a functional tape job that they can use for everyday activities. Not so much that you would use it necessarily in sports and athletics, because then at that point you'll probably be wanting to use a brace, but you can definitely try it out and see how it'll work. Easier to definitely spray an adhesive spray to help the tape stick and stay longer, especially in sports when you're going to be sweating.